Good afternoon, everyone, and thank you for joining us for today's exciting announcement. My name is Ali Ehsassi, and I'm the MP for Willowdale, and I've had the great privilege of acting as Parliamentary Secretary to the Minister of Innovation, Science and Industry. We're joined today by Mr. Rahul Singhvi, co-founder and CEO of Resilience Biotechnologies Incorporated, and the Honorable François-Philippe Champagne, the Minister of Innovation, Science and Industry. Having worked with Minister Champagne, it is clear that ensuring that Canada's leadership in the life sciences and rebuilding our capacity to manufacture vaccines and therapeutics has been his top priority since his appointment to his latest portfolio in January. He has been laser focused and tireless in helping Canadian companies scale up and ensuring that leading international companies invest in Canada. That said, it is my great pleasure to introduce Minister Champagne to highlight the exciting partnership we are announcing today.
Well, thank you everyone, and thank you for that very kind introduction. I feel that we are making history today. So I want to say thank you for joining us from wherever you might be virtually for a very, very important announcement, in fact, for the whole biomanufacturing sector across Canada. I want to say thank you, Ali. Thank you for the introduction, but more importantly, thank you for your great leadership and to be such a key member of our team in how you're doing things, in making sure that we across the nation can support our businesses, support our people, and support the ecosystem that we have here in Canada. I'm pleased to join you, Mr. Singhvi. I must say we had a very good conversation this morning. I am proud to say that you and I have already texted each other. That's a good start, I must say, in how we want to do business. And thank you for joining us, I think, from Boston today to celebrate an important investment for Mississauga, for Ontario, and indeed for whole of Canada. And we're very, very proud to be with you today. As you may have seen, ladies and gentlemen, throughout the pandemic, our government's objectives have been clear. First, to protect the health and safety of Canadians. Secondly, to building the resiliency and the growth for the future. And let me set the stage when it comes to Canada's biomanufacturing capacity. As we have all seen, our biomanufacturing sector in Canada has been in decline for at least the last 4 decades. In fact, since 1980s, we had seen a number of companies leave Canada with the result of a lack of domestic capacity at scale, which is in fact needed to attract the production of COVID-19 vaccine. But one thing is clear is that Canada is well positioned to grow its leadership in the life sciences sector. We have the talent, we have the people, and we have the ecosystem to help grow this sector. And I think the announcement of today and the fact that you're with us, Mr. Singhvi, is a testament to the quality, to the stability, to the opportunity we can provide to global firms who want to come enrich the biomanufacturing ecosystem we have in Canada. We all know that a strong and vibrant life sciences sector will not only mean preparedness for future pandemics, whatever may come next, it will also create good jobs for Canadians and making sure that we drive our economic recovery. As we all know, it's a sector which is high in innovation, and innovation normally translates into prosperity. Since March 2020, we have invested well over $1 billion in rebuilding our domestic biomanufacturing sector. And as you may have seen, in Budget 2021, we doubled down on our investment with an additional $2.2 billion towards growing a vibrant domestic biomanufacturing and life sciences sector right here in Canada. These investments are already paying off. As we have seen with the number of vaccine candidates, like for example, Mississauga of Quebec City, which is moving now to phase 3 clinical trials. And we have seen as well, as you will discover, in a number, I would say even dozens of firms in Canada, which have vaccine candidates. And I think the investments of today will assist them to make sure that once they have a vaccine, that they can move to production with partners such as Resilience. In fact, we are helping dozens of Canadian firms expand and attracting foreign investment like Resilience today. Nos investissements vont permettre d'accroître la compétitivité du Canada à l'échelle internationale dans le secteur clé des sciences de la vie. Avec ces investissements, dans le futur, le Canada pourrait même devenir un exportateur de vaccins et de produits thérapeutiques. En d'autres mots, nous nous donnons aujourd'hui encore les moyens de nos ambitions. Et grâce à un investissement comme celui-là d'aujourd'hui, nous allons positionner le Canada dans une position enviable pour attirer encore d'autres investissements et favoriser la croissance des entreprises canadiennes dans le domaine des sciences de la vie. So to build on our momentum, I am pleased today to announce a major investment, I would say a game-changing investment in new domestic biomanufacturing. We are investing close to $200 million in Resilience Biotechnologies to help the company modernize and expand its facility in Mississauga to help support a project of more than $400 million. This will help us both in the fight against COVID-19 in the medium term and to ensure better pandemic preparedness, whatever may come next. Cela va nous aider à la fois à lutter contre la COVID-19 et à garantir une meilleure préparation contre de futures pandémies. Une fois complétée, la nouvelle installation pourrait fabriquer entre 112 millions et 640 millions de doses de vaccins à ARNM par année. Cet investissement permettrait au Canada pour permettre d'attirer chez nous au Canada justement la production de vaccins, non seulement pour le marché domestique, mais pour le marché international. So what I was saying, once completed, this new facility is expected to be able to manufacture between 112 million and 640 million doses of mRNA vaccines per year. That will be putting Canada in a position of strength whatever may come next. This expanded facility will indeed position Canada to attract vaccine to be manufactured here for both the Canadian market and the export market. As we have seen in COVID-19, we will only be safe when everyone is vaccinated. So this investment will also create and maintain an average of 500 high-skilled full-time jobs for the next 25 years in Mississauga, in Ontario, and in Canada. And I think this is very significant because what we wanted to see with Resilience was not only an investment to grow their presence, but to make sure as well that they would invest in the ecosystem, that we would invest in people, that we would invest in research and development to make sure that this becomes one of the best facilities in the world. This is indeed good news for Mississauga, it's good news for Ontario, and it's good news for the growing life sciences ecosystem all across Canada, because I expect Resilience to be a partner with many of the Canadian firms which also have vaccine candidates. Now they have a partner, another partner I would say, who can help them manufacture their vaccines once approved. As we have seen, ladies and gentlemen, Canada has the talent, the innovators, and the drive to build back better in the life sciences sector. We have announced a number of investment, and I think today is another testament to the strategy that we have adopted to make sure that we take immediate strategic action with a long-term vision. Today's announcement is further proof that our country, and indeed our efforts, all of our efforts are attracting major investment in this space are paying off. By investing in biomanufacturing, we are indeed creating jobs, ensuring better pandemic preparedness, as Canadians would expect from us, and growing a sector that will play a key role in our economic recovery. So I want to say to you, Mr. Singhvi, congratulations to everyone at Resilience. We are excited to be supporting you in this important project. I would say to you and your team, seize the moment, be ambitious, and Canadians will be by your side to make sure that you are successful and indeed that we can all be successful. With that, I will turn over to you for the remarks. Merci tout le monde.
Mr. Champagne, thank you very much for having me alongside with you here today. I'm deeply honored to be partnering with the Ministry of Innovation, Science and Economic Development on addressing one of the most pressing challenges of our times, which is this pandemic. The investment that is being made by the Strategic Innovation Fund in resilience will modernize and expand the production capacity at our Resilience Biotechnology site in Mississauga near Toronto. This capacity will help prepare Canada for addressing future pandemics and will help them not only with production, but also with innovation so that we can be prepared for whatever the future may bring. We don't know what the future enemy is going to be, but by having innovation, by having technologies that can be implemented at the last moment, we will be able to address no matter what the future brings. And that is the kind of resiliency we want to bring to Canada. Resilience was formed largely to address this kind of a problem. We realized last year when we started this company that we were just not well prepared to address pandemics by these type of viruses. And in order for us to be better prepared, we have to invest more in not only the technologies that create new vaccines, but also the production technologies that are necessary to produce enough quantities of these vaccines so that we can avoid the tragedy that we are seeing today. It's not that we don't have good vaccines, we just don't have enough quantities. And that's why we continue to see so much death. And I think we should be able to address that in the future by investing in production capacity, in production technologies, which is why National Resilience was formed. I'm so excited that we are now going to get some much needed investment in our facility in Mississauga, which is going to create additional capacity, and not only in the production of the drug substance, which is the upstream and downstream parts of the production of the drug or the vaccine, but also the fill finish, which is sometimes the bottleneck in creating more vaccines. It's going to have the end-to-end capability to be able to produce the vaccines, not only for Canada, but hopefully for outside the Canadian population. As you said, that we should be able to support global health through exports, because the capacities out of this facility should be sufficient, more than sufficient, to address the Canadian population. We are going to make this facility into a multimodality facility. What that means is that it's not just about producing vaccines with messenger RNA, but also with recombinant proteins and adjuvants and other type of technologies that may be necessary for different type of viruses. And this is what I meant by adjusting the technology of making the vaccine to the pathogen that is hurting us, because we don't know what technology ultimately will be needed. So by having the flexibility to make multiple types of vaccines in this facility is going to give us more resiliency. I'm also very excited that we are doing this in Ontario, in Mississauga, where there's a tremendous amount of talent, which we can leverage. The universities in the Toronto area are amazing. They're some of the best in the world. We want to take advantage of the talent, both in the production side as well as on the science side from the area, and leverage that in building our own facility and also synergizing what we bring to the table with what's already over there. So I'm really super excited today to be participating in this collaboration. This is something that we believe very strongly will create not only a great production site, but probably one of the most advanced production facilities for vaccines in the world. Thank you.
Well, thank you, Mr. Singhvi. I'll turn over to, I think, our MC, Ali.
We have, a short video, I think, that we would like to show you.
Sure.
At this point.
Resilience Biotechnologies, Inc. is a Canadian subsidiary of National Resilience, Inc., a company founded last year during the pandemic with the goal of building a better system for manufacturing complex medicine. This 136,000 square feet facility has been operating for more than a decade and employs 300 plus people. The funding will be used to increase our upstream, downstream, and fill-finish manufacturing capacity for vaccines and therapeutics, including novel technologies such as mRNA that are now being used to fight COVID-19. The expansion will further establish Resilience as a vital biomanufacturing organization in Canada, maintaining the 300 existing jobs and creating 200 new full-time positions. This investment will also help us prepare Canada for the future pandemics.
Well, on that note, thank you very much for that. I think it's high time that we actually did open it up to the media. I'm sure they have many, many questions. So we have with us a media officer today, and I'll be handing it over to him.
Thank you, merci. You may press star 1 at this time if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. You have a question from Ryan Tumulty from the National Post. Please go ahead.
Yeah, hi there. I'm wondering if this investment, this spend from the federal government, has any sort of conditions that would require Resilience to supply Canada first in the event of a future pandemic. Are they required to reserve space essentially for us in the case that it's needed?
Mr. Singhvi, do you want to take that and I add to your response?
Yeah, as far as I know, there are no such conditions. But of course, we will act responsibly and want to make sure that as we respond to a potential pandemic, that we produce quantities that are sufficient not only for the local population but also for outside. So this question about who gets the vaccines first, hopefully, is not going to be a big question.
And I would say, Ryan, as part of all our investment, there's a number of clauses which are commercially sensitive as we're trying to attract investment, and we're in competition with other G7 countries. But one thing I can assure you is that we will make sure that whatever is produced in Canada, that Canada would have primary access, as Mr. Singhvi just said. I was calling you minister already. As Mr. Singhvi was saying, is that we will make sure. And if you look at the production volumes, we're not where we used to be. And you know that well, because before a pandemic, one of the challenges of Canada is that when it comes to fill and finish capacity, that was the big impediment to attract some of the leading vaccine manufacturers, because we were at the 20, 30, 35 million doses per year. Now with the investments we're doing today, and a large part of that investment is repayable. The vast majority of the investment is repayable. Certainly when you're talking about in the mRNA space, because the facility will be flexible depending on the vaccine family, we will be in a position to source primarily domestically, because if you look at the population of 38 million and a capacity of 600 million, certainly there is tremendous capacity, almost 20 times the Canadian population, a bit less. So therefore, there will be enough capacity, and we'll make sure, because what we're talking today is an investment in CapEx, in making sure we expand the facility, that we modernize the facility. But obviously, when it comes to advanced purchase agreement, that we would be signing with CDMO, just like Resilience, obviously, that's also part of all our contracts, that Canada comes first when it comes to doses that are produced in Canada. But today, the investment that Mr. Singhvi was referring is the one on CapEx. But obviously, this is usually coupled with what we call advanced purchase agreement to make sure that we have all the capacity we need in Canada. And let me remind you, you know me, I won't stop there. Resilience is a good success story today, but the road is not over. We are continuing to attract significant investment, helping our domestic biomanufacturer to produce in Canada. And what I think is interesting, and I'll stop there, is the complementarity between a number of vaccine candidates, which we're saying, Minister, there's a gap. We might create these vaccines, but who's going to manufacture them? Who's going to do the fill and finish? So from the start, what I said is that we want onshore as much of these capacity as possible. You've seen with Novavax, for example, you've seen with Medicago, you can think of Providence, Absela, we have a number of companies, but what Resilience is bringing is the gap that had been identified to make sure that once and when we have a vaccine here that has been authorized by the authorities, that we can produce it domestically. But moreover, is that now with Mr. Singhvi, we can go and attract some of the leading vaccine manufacturers to come and produce in Canada because they see Canada as a safe bet. And that was part of the discussion I had with Mr. Singhvi this morning. So I can assure that what comes out of that facility, Canada will come first, and there'll be enough capacity and excess capacity to serve the world.
Yeah, just as a follow-up, can you tell us when the facility will be ready to produce? And of all the companies that are out there, why you decided to make such a large investment with Resilience, who, as you said, are a new company?
Well, Mr. Singhvi can give you more, but we see that as them becoming online in 2023 and the project to be completed in the spring of 2024. Why Resilience? Well, just look at their track record. This is a company which has the wherewithal to bring that. We, like I said, we were happy to make a contribution, which is, the vast majority of it is repayable. So it's really supporting the company in an investment. And I've said it many times, Ryan, and I think we have to be clear with Canadians, is that in order to attract some of these bio-manufacturing company, the life sciences company, governments have to be part of the equation. We are competing with the United States. We're competing with a number of countries in Europe, in other G7 nations who want to attract these capacity in their country. So what we're doing now is building capacity, making sure that we can be more resilient, because whatever comes next, when we have Resilience online and others, because that's not the end of the journey, trust me. This is one, and we will continue. We've seen in other type of vaccines that we added capacity. Just think about Sanofi. I would think this is probably one of the second largest investment, but the footprint will be in Canada. And that, for me, is key to support the small made-in-Canada vaccine development, so that once they have a vaccine which is approved, hopefully by Health Canada, they can then partner with a partner of choice, which is Resilience. Mr. Singhvi, maybe you want to add to that?
No, thank you, Minister Champagne. I'd like to say that, I think while this particular capital investment is going to take about a couple of years, like by spring of 24 for the extension to be completed and for the renovations. But remember, this is an already operating facility. So it is active right now. We are likely going to continue to make product in this facility while we use the new capital to further expand its capabilities and capacities. So that's an important consideration, because even now it's possible for us to support production of vaccines. So that's point number one. Point number two is that these type of very sophisticated products require not only capacities, but extraordinary human capital. You need to have people that have done this before, that have a track record of making these type of vaccines. So while Resilience is a new company, no doubt, but the people in the company have over 100 years of experience in the top team in vaccine development. So that kind of capability is quite important, because we can improve the probability of success because of our knowledge of the product. So that's the other consideration that I think we need to take into consideration. And I believe that the government took that into the equation in their investment decision, which I very strongly believe that will be a true assumption that having the right capabilities, having the right talent, along with the capabilities and capacities of the facility, is ultimately what's going to lead to a successful outcome.
Back to you, operator.
Thank you, merci. La prochaine question de Pierre Saint-Arnaud, La Presse canadienne. La parole est à vous.
Oui, bonjour, M. Champagne. Vous m'entendez bien?
Oui, je vous entends, M. Saint-Arnaud. Allez-y.
M. Champagne, je veux juste comprendre une chose là, pour être bien sûr. Resilience n'est pas un développeur de vaccins, donc c'est un fabricant qui va fabriquer avec les brevets d'autres entreprises. Est-ce que j'ai bien compris? Et j'aimerais qu'on m'explique, quand on dit approximativement de 112 à 640, la marge me semble pas mal grande. Là,
ça va me faire plaisir parce que j'ai posé la même question. D'abord, c'est quand vous regardez comment les vaccins... Mr. Singhvi, you allow me, I'll just do that in French. I suspect my French is slightly, perhaps better than yours, so I'll take this one and I'll offer a translation for you if there's any aspect of it. Mais, Monsieur Saint-Arnaud, la réalité aujourd'hui, c'est quand vous voyez les grands manufacturiers de vaccins, il y en a qui sont intégrés verticalement, c'est-à-dire qui font la recherche et le développement et qui produisent eux-mêmes leurs vaccins. Mais il y a bon nombre de compagnies, ce qu'on appelle qui fabriquent des vaccins, des candidats de vaccins, qui, eux, n'ont pas cette capacité-là de fabrication et de remplissage. Alors, souvent dans l'industrie, ce que vous avez besoin, c'est des compagnies comme Resilience qui, eux, font la partie, que j'allais dire, la fabrication et le remplissage. Souvent dans l'industrie, c'est deux types d'entreprises différentes parce que le genre de capacité que vous avez besoin pour faire de la fabrication et le remplissage, ça prend de grandes usines. Si vous voyez, par exemple, dans le modèle de Moderna, cette partie-là, j'allais dire, du vaccin, elle est faite par des compagnies comme Resilience, qu'on appelle en anglais des CDMO, qui sont ce qu'on appelle des contract manufacturers. C'est des gens à qui on donne en sous-contrat la fabrication et la mise, j'allais dire, le remplissage et même la mise en boîte dans les fioles de ces vaccins-là. Pourquoi la distinction entre 112 et 640 millions? La réponse, elle est simple, ça dépend du processus parce qu'une usine comme celle de Resilience, vous savez, ça peut accommoder toutes sortes de processus manufacturiers et ça dépend aussi de la grosseur de la fiole. Donc, ce que vous avez là, c'est la capacité maximale. On peut faire de ce qu'on appelle du mRNA, mais on peut faire d'autres familles de vaccins aussi qui sont disponibles parce que ce que vous avez là, c'est une grande usine finalement de fabrication et de remplissage. Et pourquoi c'est important pour l'industrie canadienne? C'est qu'au Canada, on a investi dans plusieurs, je dirais plusieurs douzaines de compagnies qui avaient des candidats de vaccins. Et là, d'avoir un joueur de la taille de Resilience qui vient chez nous, comme je le disais tantôt, un des freins qu'on avait au départ de la pandémie du COVID, c'était le fait qu'on n'avait pas justement cette capacité-là de pouvoir faire du remplissage, de pouvoir faire de la fabrication. On était limité environ à 30 à 35 millions. Là, vous amenez un joueur parmi d'autres dans le décor canadien qui dit « Moi, je peux en faire jusqu'à 640 millions. » Alors, vous comprenez que la donne vient de changer. Et ça va permettre à ceux, par exemple, qui auraient découvert, surtout dans la mRNA, parce que vous savez, ça prend une toute petite quantité pour pouvoir produire plusieurs millions de vaccins. Et ce que vous allez voir avec ce qu'on annonce aujourd'hui, ça sera le plus grand bioréacteur au Canada. On parle de 16 000 litres pour ce qu'on appelle des protéines subunit en anglais. Alors ça va être le plus grand bioréacteur au Canada. Et ça, c'est ça qui va permettre de rebâtir l'écosystème. Ça donne une chance aussi aux plus petits joueurs dans l'industrie de dire, écoutez, si le vaccin que vous avez développé obtient l'autorisation de Santé Canada, vous allez, par exemple, avec un Resilience ou d'autres, vous allez pouvoir devenir partenaire pour le produire à échelle. Parce que l'idée maintenant, c'est de dire, il faut s'assurer qu'on ait assez de production domestique pour faire face à la demande canadienne. Mais là, ce qu'on dit, c'est que non seulement on parle de production domestique, mais on parle aussi de potentiel d'exportation parce que ça dépasse bien largement la population canadienne. Alors, c'est là l'intérêt parce que là, vous investissez dans l'écosystème, vous investissez dans le talent et là, vous amenez une capacité de fabrication qui va nous permettre, nous, avec évidemment les différents acteurs, de dire aux grands joueurs de l'industrie pharmaceutique, vous pouvez venir produire au Canada parce que de mémoire, à 640 millions, là, on tombe dans les grands joueurs de la production de vaccins à travers le monde.
Et en sous-question, M. Champagne, on a vu dans le passé qu'on avait une capacité de production de vaccins qu'on a tout simplement laissé aller. Comment est-ce qu'on fait pour s'assurer que cette fois-ci, ça ne se produise plus, que même s'il n'y a pas de pandémie et donc pas de demande là, à très, très grande échelle pour des vaccins, qu'on ne laissera pas tout simplement mourir cette industrie-là là, comme on l'a fait dans le passé?
Ben, je pense que l'industrie s'est désintégrée au cours des années sur 40 ans parce que vous avez vu, par exemple, les chaînes d'approvisionnement ont changé, les modèles de fabrication ont changé. Là, ce qu'on est en train de faire, c'est de rebâtir. Et aussi, on s'assure, parce que, par exemple, les engagements, je prends juste, par exemple, les engagements au niveau de l'emploi, c'est sur 25 ans. Donc, on parle au moins sur 2 à 3 générations, voire où les investissements qu'on a faits vont permettre de faire ça. Puis une fois que vous avez, j'allais dire, cette capacité-là, évidemment, moi, je n'ai pas de boule de cristal, mais c'est clair que tout ce qui s'appelle les sciences de la vie va prendre une importance particulière dans les différents pays du monde. Et moi, depuis le début, j'ai cette vision-là que le Canada peut jouer un rôle de premier plan, c'est-à-dire d'abord, je veux qu'on soit mieux préparé parce que ce qu'on a vu durant cette crise-là, c'est qu'on aurait voulu pouvoir être capable de se baser sur une production, une capacité de production de cette ampleur-là chez nous. Mais en même temps, c'est comme tout le monde dit, on sera seulement en sécurité lorsque tout le monde aura été vacciné sur la planète. Alors là, il y a un rôle pour le Canada à jouer. Et je suis content de voir parce que vous savez, une compagnie comme Resilience, d'abord qui est à Boston, vous imaginez, dans un autre écosystème qui va bien, qui choisit le Canada. Moi, c'est à chaque fois qu'on est capable d'avoir, comme on a eu avec Sanofi, quelqu'un qui fait le choix de venir chez nous, d'investir dans l'écosystème, de s'associer pour le faire grandir. Bien, moi, j'y vois un signe positif. Ça veut dire que le Canada demeure une plaque intéressante, une plaque tournante. Et c'est avec des investissements comme ceux-là qu'on va attirer d'autres. Parce que vous savez, c'est un peu ça l'idée de l'écosystème. C'est quand l'écosystème s'est effrité, vous commencez à perdre un peu la chaîne dont vous avez besoin pour devenir un acteur important. Là, on vient de remplir, j'allais dire, un manque qu'on avait, qui est au niveau du remplissage et de la fabrication. Et ça va permettre, par exemple, aux autres joueurs canadiens, plus petits souvent, qui sont en train de développer une solution canadienne, de pouvoir trouver un partenaire ici, chez nous, s'ils veulent produire à grande échelle.
Thank you. Merci. There are no further questions. Nous n'avons plus de questions pour le moment.
Thank you very much for that.
Back over.
Go ahead, Lali.
Thank you very much for that. Thank you to everyone who participated in today's event and announcement. Thank you to the minister. Thank you to Mr. Singhvi and the exceptional team that you have brought together at Resilience. We have every confidence that today's announcement will allow us to secure our position in the life sciences and that it will spawn many partnerships to come. Thank you.
Thank you very much, sir.
Merci tout le monde. Thank you, Mr. Singhvi. It was a pleasure to meet you virtually. And I wish you all the success and your team in Canada. We will be there with you. Thank you very much.
Looking forward to it.
Merci tout le monde. Bonne journée. Merci.